Hello and good evening. This is for Unit 4 assignment. I feel like PowerPoint kind of does an oral presentation if you're having to do the voiceover, so I prefer to do it this way. I do have some notes because I get a little bit camera shy, so bear with me. But what I'm going to be doing my presentation on is going to be an open cholecystectomy. The laparoscopic version and the open, I feel like had more instruments in my pack that I could, use. So I went with the open one. An open cholecystectomy is a surgical removal of the gallbladder. It is through a single larger incision in the upper right abdomen. Their approach is typically used when laparoscopic surgery is not possible. In cases of severe infection, extensive scar tissue from previous surgeries, or complicated anatomy. The gallbladder is a small organ located beneath the liver. It stores bile. It produces by the liver and releases into the small intestine to aid in digestion, especially after eating, fatty foods. When gallstones are inflamed, they block the normal flow of bile, and that may cause the gallbladder to be removed. Anatomy that I would say, that's included, and unfortunately I don't have a printer to, to show the diagram, which PowerPoint would be useful for this, so I apologize. But it would be like the gallbladder, the cystic duct, the cystic artery, and the common bile duct, which if you've watched Grey's Anatomy, that is a no-go. You do not clip the common bile duct. I know that. Let's see. Let's go to instrumentation. Commonly used in an open cholecystectomy, the 4 instruments that I found are going to be my number 3 knife handle. This is my card. We use this a lot in dental, so it's definitely something common for me to use. But here we are. It is cutting or dissecting, used to make initial, skin, a skin incision. Inspection wise, I would say you want to check for sharpness of the blade if there was a blade attached, secure blade attachment, and handle integrity. So we would want to make sure that obviously this is in full functioning. There's no breaks, there's no, anything like that. You would want to make sure where the blade slides on that there's no malfunctions in that. I always have a hard time, I feel like, saying this one, but Metzenbaum scissors. It would be the category for cutting and dissecting. Function would be used for cutting delicate tissues around the gallbladder. Let me see here. Here's my card. I did it backwards. Here are my scissors, my box lock. I feel like out of everything that I've learned about instrumentation, the box lock is what probably scares me the most, because so much, bioburden could be in there and you wouldn't even know if you didn't clean it properly. But these scissors, you would check for sharpness, blade alignment, and hinge movement. You would want to make sure that nothing is stopping it from going to its fullest. If the blades are dull, it's not going to do its job. Next I have Kelly hemostats, which I may be wrong in this, and I'm okay to admit it, if this is like fault on my end, because to me, hemostats are a little bit different, obviously, in the dental field, but I felt like this was the appropriate one. It's clamping and occluding function, used to clamp blood vessels, such as the cystic artery and small bleeders. Here we go. It does have serrations all the way down. And I guess my confusion still with these is, like a hemostat has a different handle in my view, but this looks correct, and I'm going to read up on it some more because I feel like these are super common and I should know these by now. But dental, medical, I guess my brain's just kind of interchanging. But again, you would inspect the jaw teeth, the alignment, and the locking mechanisms. Make sure your ratchet is, fully functioning, making sure that it's not popping out after you've clamped it, making sure everything is, working smoothly. Here's my card. This one did have the Kelly clamp and the Cryo clamp, so just here. Last but not least is my young Cower suction tip. Here is that guy with my little, end that comes in and out. Category would be suctioning. Here's my correlating card. Used to remove fluids and blood from the surgical site. Inspection, ensure the tip is not clogged, cracked, broken. Connections are secure, so this would be one of my secure connections. Making sure that everything is working and it's going to do its job, and suction. So those are my 4 instruments. The procedure, I feel like I kind of already went over, but in an open cholecystectomy, the surgeon would make a curved incision under the rib cage to access the gallbladder. Once the abdominal muscles are separated, the peritoneum is open, retractors are placed to hold the area open. I wish we had, I know we have some really good retractors in there, but none that I could have used in my presentation. The surgery then carefully identifies the cystic duct and the cystic artery, which are clipped or tied off and then cut. The gallbladder is dissected away from the liver bed using scissors or clamps. Once it's fully, detached, it is removed through the incision. The surgical site is checked for bleeding or bile leaks. Then the area is closed in layers. The importance of inspecting all of my instruments in sterile processing. One, we're preparing these instruments for our patients. It is critical for patient safety. My scissors and my clamps must be sharp or aligned to avoid tearing tissue or causing trauma. My retractors must be stable or free of cracks to safely hold open the surgical field. My suction tips must be able to do their job and remove any blood or blockages during that surgery, so my surgeon can see and we have a clear view of that field. Let's see. I'm out of breath. I apologize. I feel like my, I'm throwing a blank. I apologize. My number 3 handle, we have to make sure that it is firm, it is where it's supposed to be exactly when the surgeon needs it, and that blade is going to stay in its holder. I think all in all, in an open cholecystectomy, it is not only a vital procedure for removing a diseased gallbladder, it relies on a range of carefully chosen surgical instruments, each with a specific function. As a sterile processing technician, our role in ensuring that these instruments are clean, functional, and safe directly supports the surgical team and protects the patient. I mean, that is our number 1 goal at this point. I hope you enjoyed my oral presentation. I would love to have some feedback on, some of the various things that I did touch on. If I did miss something, please let me know. Thank you.